Implant failure. Implants fail, and there is usually a multifactorial situation. We have systemic factors and we have local factors that contribute together over the years to implant failure. It is a concern when implants fail in a larger amount, and sometimes it affects a full mouth rehabilitation. I am Antonella Garbacia, and today I'm going to present you a case where you will see a situation where all the implants had to be removed and full mouth rehabilitation was done the second time. Here's our beautiful patient. This patient situation presented with multiple failures of maxillary implants due to inadequate peri-implant tissue, due to severe bone loss. More than 50% of the bone is lost, and inadequate access for hygiene. Her severe xerostomia contributes to the situation as well. Difficult areas for her to access due to some arthritis present in her all around her fingers, and very difficult access to for dental care to be able to maintain or improve the health of those implants. So over the years, we knew and we established that this situation will eventually have to change. Eventually, all the implants will have to be removed, and she will undergo a new surgical procedure and a new full mouth rehabilitation. Over the years, she understood that more and more bone it's been lost. This is the radiograph of initial situation. So we actually approached this radically. We worked with a group of oral surgeons from the area, and she did not want to have any bone grafting done due to prior unsuccessful grafting procedures. So we've been discussing the situation with our patient, and we prepared our patient to understand that that might be a moment where we have to remove, might be a time where we have to remove all those implants and start all over again. Patient did not want to wear dentures, so dentures was not an option. So grafting procedures from her past experience did not work, so we didn't have a graft option for her to rehabilitate her again. So the only option will be to find residual bone or to reach for the zygomatic arch, and this is really what happened. From the initial situation when more than 50% bone was lost all over 4 quadrants, we went in and worked with a group of oral surgeons in the area, and a couple of implants were placed. Very good plate implant over here, and one implant actually failed. We lost that one, and a new zygomatic implant was placed. As you can see, the way technology is available nowadays, surgical teeth or immediately placed provisional restorations are available for our patients. They are usually 3D printed and not necessarily attached very firmly around those new implants. As we allow the patient to heal for a couple of weeks, we start a new design. We start analyzing the smile. We start analyzing the symmetry of her smile, the dimension of her bite, and in accordance to a facially generated, facially driven smile creator. We use ExoCAD software in our office, so we can present with our smile design different versions. We can identify different molds of teeth and a different smile design. For our beautiful patient here, we chose an oval to rectangular shaped teeth, and in a fashion where she would be able to access for hygiene. We train her over a period of time where she would have access to using Proxa brushes, different devices. As you can observe here, all the contours of this prosthesis are convex. There is very little concave areas where we have food retention or food impaction. We have generated the milled provisionals. We are very proud. Milled provisionals are probably the best way you can generate prototypes. They are attached to titanium bases. With the technology we have, photogrammetry or regular cast creating, we can assure a passive fit. Those are large reconstructions, especially the second time after more bone and more gingival tissue has been lost. So this prosthesis will be a little heavier. It will have a tooth replacement and it will have a soft and hard tissue replacement. So it will be a little taller and a little heavier than the first set of prosthesis. We are allowing our patient to test the prototypes, the smile, the chewability, the access for hygiene, and she is actually learning on how to speak again around this a little bit larger and taller prosthesis. Once we have all the parameters that we are interested, we are going for the final reconstruction. You can see here in this slide the maxillary, mandibular, and together upper and lower implant bridges. It is a beautiful work. We take pride in our work. It's being done in our office, and this is final panoramic radiograph. In detail, upper and lower prosthesis have a lot of ceramic, micro and micro texture, and this reconstruction is glazed with liquid porcelain, and it is presenting with a very natural look. So I hope this case was interesting to you. And this is our final smile for upper and lower second set of prosthesis supported by new set of implants. If you find yourself in a similar situation where long time implants that you were wearing are losing bone due to many different factors, risk factors that are local or systemic factors, do not hesitate to reach out to professionals. Optimal health can be gained the second time. New set of implants with grafting or without grafting can be placed, and a new set of beautiful teeth, implant supported, not dentures, but ceramic teeth can be built again. So do not hesitate. Optimal health can be achieved again. Thank you for watching.